We are joined by Dr. Mark Schmeltz today, a family practice physician with Beacon Medical Group. Hi, Dr. Schmeltz.
Hello.
We're going to talk about telehealth. Telehealth is booming. So for those people who are unfamiliar with the platform, tell us about these virtual visits.
Well, telemedicine allows us to use video to see our patients and our patients to see us and have a conversation rather than an in-person visit. We use a secure video platform, so all of our information is private and a little less accessible, unlike FaceTime or some other non-proprietary type platform.
Tell us about how they are being used right now. How can patients use telehealth or these virtual visits?
Well, these virtual visits are meant to keep you safe, the patient safe, as well as the providers when we're in this pandemic situation. The COVID-19 viruses spreads very easily. So we want to keep well patients out of our offices if we can. And this platform allows us to evaluate you, whether it's a refill of medications or checking in on your diabetes, or if it's just a minor acute illness that can be taken care of with a visual interaction rather than being able to see you in person.
So what's an easy way to explain to people why they would use it or for what they would use a televisit for? Because this is relatively new, right, in terms of the platform being so widely available during this pandemic.
Absolutely. So a lot of the doctor's offices will be helping the patient make that determination of what's appropriate for a telemedicine visit. And it ultimately comes down to what your doctor decides is appropriate. But in general, we're going to be wanting to see patients for their chronic conditions. So if you do need medications refilled, like I said, but if you have an urgent need, especially a cough or respiratory symptoms, which is the presenting symptom of this COVID-19 virus, we can evaluate you visually without having to bring you out into public and leave the safety of your home and possibly expose others to the virus.
That's so important right now, isn't it? So tell us, how easy is this to use? Connected care, tell us about a virtual visit, what you need to do if you want to do this sort of a visit with your physician.
So it's really easy. Most of us are familiar with smartphones or computers, and you need a video camera. So on your laptop, most laptops have video cameras and audio, or your smartphone. And you would go to beaconconnectedcare.org, one word, on your web browser, and you can register and be able to use the video equipment through your computer, or you could go to Beacon Connected Care through your app service, whether it's through the Apple service or the Android service, and download it onto your phone. And then you can enter your information and be able to connect to a physician. Beacon Connected Care has a virtual urgent care service that's operating 24/7. And a lot of the Beacon offices now have the ability to do scheduled visits through this platform.
How do you know if your physician is on telehealth?
The best way to know is to give them a call. We've done a massive effort and are ongoing with our efforts right now to make sure that all of our Beacon physicians have access to this technology. And as we get staffs trained, more and more docs are going to have this ability.
Okay. Thanks so much for your help today.
Thank you.